Hi, everyone. Good evening. Welcome to your Health in Your Hands webinar. Can we see who is with us? Hello. Can you let us know where you're joining from? So if you can see us, if you can hear us, please let us know in the comments that you can see and you can hear. Hello, Latifa. Welcome. Hello, Latifa. Welcome. Yes, Faith from Lagos. Welcome, Faith. Please, as you join us, just let us know where your name, where you're joining from, and if you can see and hear us very well. So, welcome, Faith from Lagos. How are you doing today? I hope your day was wonderful. Good evening, Jemilat. Please, where are you joining us from? Welcome to the webinar. We're so happy to have you here. Please, where are you joining us from? We have Toyosi from Ogun State. Toyosi, welcome. We have Jemilat from Kogi State. Welcome. Welcome to the webinar. We're so happy to have you. Let's give people a few minutes to join us. Please, as you join us, let us know your name, where you're joining us from, and if everything is working well on your end, the volume, and if you can see us very well. Okay. We have Mr. Shitu from Zaria, Kaduna. We have Mr. Sunday from Ikeja. I can see your name, Mr. Sunday, but I don't think other people can see your name, though. I can see your name from here. Welcome, everyone. Welcome. So, this is your Health in Your Hands webinar, and is a weekend. I trust that everybody has had a wonderful weekend so far. This is part of our series. I think this is the fourth one we've done now. Targeting diabetes, raising awareness for diabetes so that everyone can understand what diabetes is about and the best way to actually take care of themselves. Our goal is using knowledge to help people control their blood sugar effectively. And one of the ways that we can do this is to know what diabetes emergencies are. So we have Mr. Sunday from Atlanta. Mr. Sunday, welcome. And diabetic emergencies are very serious, as the name implies, emergencies, right? They are usually, we usually encounter them in the hospitals a lot. And unfortunately, many times they do not end well. All right. So an emergency is a situation where, we know that there may be loss of life if care is not taken. So that is why we had to have a webinar especially to address this very, very, very important topic so that everybody that attends this webinar with their loved ones can know the signs of diabetic emergencies just by looking. You can just know that this person or myself, I feel like I'm about to have an episode, right? And when you find out what you should do, right? So this webinar is themed Your Health in Your Hands, so that even in the comfort of your home, you know what to do immediately to avoid loss of life. This is extremely important. And we have our guest, Dr. Wale, who is, I'm going to be bringing him up now, who is a resident doctor in emergency medicine in the UK. And of course, this is what he does every day. He helps people that have emergencies, different kinds of emergencies, including diabetic emergencies. He's going to be teaching us about this very important topic and what we can do, and so that we can also teach other people around us. Dr. Wale, thank you so much. We are so happy to have you here. Thank you for joining us.
Yeah, thank you very much for having me and for inviting me to your program. And I hope that after this program that the audience will be able to learn a lot and also apply it in their in their lives and also in the lives of people around them so that they can help as well, at least pre-hospital before coming into hospital. So thank you for
Yes,
having
that's
me.
very important. Thank you very much, Dr. Wale. We are so happy to have you. So let's just say welcome to Dr. Wale while I share his slides and we can kick off immediately. All right. Just okay, doctor, over to you.
All right. So today, basically, I'll just be talking about diabetic emergencies. And during this uh, session, we'll be talking about what diabetic emergencies are and how we can identify diabetic emergencies and what to do pre-hospital. That's before coming to hospital, before coming to hospital or before the situation becomes dire, and also how to prevent a diabetic emergency. So before I go into diabetic emergencies, really, I just want to talk briefly about diabetes. We know it's very common, and even the prevalence of diabetes keeps increasing, especially in our subcontinent. Now it's been identified more and is being picked up more, and that's why it seems like the incidence is increasing, coupled with change of diet and change of lifestyle as well. So we're getting to see more people coming up with diabetes, even at a younger age now. And basically, it's a condition where the blood sugar is too high for the body to handle, and usually it can be as a result of lack of production of a hormone in the body called insulin, or the insulin not working effectively or as well as it should. So that's basically what diabetes is. And generally, we have two major types, which are type 1 and type 2 diabetes. Type 1 diabetes basically is more or less, it starts in childhood and it's as a result of lack of production of insulin. And you can also get it coming later on in life, but mostly starts in childhood. And then type 2 diabetes is the one that starts later on in adulthood, but recently have now been getting commoner in the young and adolescents as well. And some of the symptoms of diabetes generally would be patients going to toilet, urinating more frequently than normal, especially at night. And this is not just a symptom of diabetes, could be a symptom of a urinary tract infection. But once someone starts having a symptom like this, then possibly diabetes should be at the back of your mind as well, and something that you have to rule out. Being really thirsty, of course, because you're urinating a lot, you're losing a lot of fluids, you definitely will become thirsty. And again, because you're losing a lot of fluids, the body isn't absorbing the sugar, it's staying in the bloodstream, it's not using the sugar for energy. So you become more tired than normal, end up losing weight as well, because the body ends up breaking down fats just to produce energy, since the sugar cannot be used as energy. And then you're also at risk of having infections and having wounds not healing, and not healing as fast as normally it should normally, and then sometimes having problems with your vision as well. So these are just like the basic intro to what diabetes is and some of the common symptoms that you can get with diabetes. So now to move to diabetic emergencies. Diabetic emergencies generally are very, very, very common in the emergency department. And here in the UK, we see them very, very often. As a matter of fact, every single day in AD, we are dealing with one type of diabetic emergency or the other. And just this past week, I've had several patients come in with one form of diabetic emergency or the other. Um, just recently treated someone with very severe hypoglycemia, that is low blood sugar, which is one of the general two classes of diabetic emergencies. I'll talk about that briefly when I get to the hypoglycemic session. So generally, there are two main classification of diabetic emergencies. So you can have hypoglycemia or hyperglycemia, which is basically low blood sugar or high blood sugar, and both of them have a wide range of symptoms, and that can vary from a very minor symptom to probably like feeling hungry, for example, in hypoglycemia, to very severe symptoms like loss of consciousness and possibly death as well. So the first one I'm going to talk about will be hypoglycemia, which generally is low blood sugar, and that is when you check your blood sugar levels below 70 milligram DL. I think that's the unit that we use mostly in Nigeria, or here in the UK, we say a millimoles per liter, which is less than 4 millimoles per liter. And usually, when someone has had too much insulin compared to glucose in their blood, would most likely cause them to go into hypo. And usually, this is more in patients with type 1 diabetes compared to patients with type 2 diabetes, although this can occur in patients with diabetes and type 2 diabetes too, if they have taken an overdose of their medication. And again, I've seen two cases like this quite recently, two different cases where the first one was a young lady that came in severe hypoglycemia. Unfortunately, it wasn't an accidental overdose of insulin, but rather an intentional overdose. Took a large amount of insulin and came in very, very hypoglycemic. The blood sugar was very low. And we managed to correct it initially. And because she had taken a large amount, while we were with her trying to get some blood samples and all that, she started to deteriorate very, very quickly, started sweating excessively, and then all of a sudden started snoring. The airways were closing, and then she just went into a coma like that. So we had to act very quickly and give her the necessary treatment. And within 5-10 minutes, she was back chatting and laughing as well. So that's sort of prompt treatment to receiving um, an immediate treatment, especially with hypoglycemia, is very, very key because compared to hypoglycemia kills very, very quickly. And like this young lady that I've just mentioned, 1 second she was fine, blood sugar dropped rapidly, and within like 5 minutes she was already in a coma. And with rapid response, within 5-10 minutes she was back talking and laughing. So, and this can happen in the community, very, very common in the community, whereby people have no idea of what to do. But in this seminar, we're just going to try to talk of the symptoms that people get, like the early symptoms and then the late symptoms. But if you're able to catch this hypoglycemia early, then you can act on it before it gets towards the worst part of it. So some of the early symptoms that you can get are symptoms like shakiness and hunger. So, for example, a patient known to have diabetes suddenly starts feeling hungry, like very, very hungry, out of the normal, and starts shaking as well, then you can tell that this person is probably going into a hypoglycemic state. And then most people know about these symptoms. Most people who are well educated about the hypoglycemic system know about it. They know when it starts to come and they know what to do. Most people, on the other hand, don't know as well what to do when this sort of symptom starts. So, and usually that is what we refer to as hypoglycemia unawareness. Very, very dangerous because if you're not aware of these early warning signs, before you know it, it's going to go straight into the late severe signs, which are like confusion, blurred vision, possibly have a convulsion as well, and you can end up going into a coma. So, identifying this very, very early is very important, and acting promptly as well is extremely important because, like I said, hypoglycemia kills very, very, very fast. Within minutes to hours, the patient can deteriorate. So, or the person can deteriorate, even in the community where you've got no emergency services available. Now, what to do for such situations in hypoglycemia? So the first thing is when you start having this sort of early warning signs, this feeling unnecessarily hungry and start shaking, start sweating excessively, quickly check the blood sugar. And if the blood sugar is low, if it's less than 70 milligram per DL, then you need to follow the 15-15 rule, which is basically having about 15 grams of fast acting carb and wait for about 15 minutes. So, what do I mean by fast acting carbs or carbohydrates? That's like a glucose tablets, for example, just about 3 or 4 glucose tablets that can suffice to help bring back the sugar into the normal range, or just take about 4 ounces of fresh juice as well. That can help, or just your regular Coke as well, not diet Coke, but regular Coke. That can help bring back the sugar back to the normal level. And usually, because you're taking it orally and not giving it through the veins or anything, it takes about 15 minutes to act, and then that sort of symptom will subside. The excessive sweating will reduce, the shaking will stop as well. And I've seen this happen all the time, and it works like magic. So that's something simple that you can do in the community. But again, if the patient, after doing this, the patient doesn't feel better, then you can repeat that again and see if that helps. And if patient is still not getting better, then you make sure you bring the patient to hospital. Next, in a case where the patient has severe symptoms, now the patient is going into a coma, or the patient starts to have a seizure or something, the first thing we need to do again, if the patient has lost consciousness, is the first thing we do is to check the blood sugar again. Check the blood sugar to make sure that blood sugar is not low. And if it's because the coma is as a result of hypoglycemia, then normally we don't encourage you to put anything in the mouth at all, because this can cause the patient to choke or to aspirate, and that would complicate matters, and patient can die very, very rapidly. And so, what we normally encourage is patients or people who are prone to having hypoglycemic episodes usually will be prescribed glucagon as an emergency, and that should only be used as an emergency in situations where the um, people are known to have hypoglycemic episodes, and the patient can definitely not take anything by mouth, meaning that patient has completely blacked out. Then you can give a shot of the glucagon, usually in the thigh muscle, and that usually takes about 15 minutes to work as well. And the patient should be able to regain consciousness. And when the patient does regain consciousness, you can recheck the blood sugar as well, and then give some sweet drinks like we mentioned earlier, and also contact the doctor just for advice to see if there's any need for the patient to come to hospital for a checkup, or they can just be managed continuously at home if the patient has regained consciousness. So these are some of the things that we can do for hypoglycemic patients on an outpatient basis before coming into hospital. And if at any point in time you have the glucagon injection, you give that, patient is still not regaining consciousness after like 15 minutes, you must bring the patient straight to hospital. Very, very, very important, because time is of the essence in hypoglycemic crisis. Um, Now, the second part of the diabetic emergencies I'm going to talk about is hyperglycemia. Now, this one, the patient usually with hyperglycemia doesn't deteriorate as fast as the patient with hypoglycemia. However, the hyperglycemia is extremely difficult to manage, and usually the patients are always very, very sick because it takes time for it to form. So a lot of things will have gone on in the body. There will have been toxins released in the body that would have caused the normal metabolism or homeostasis in the body to be deranged. And these people usually would need to come into hospital and be admitted for some days. So with high blood sugar, you have there are certain terms there. I know they are big names, but I'll try to simplify them as much as possible. So the first one is what diabetic ketoacidosis is. That is extremely common in patients with type 1 diabetes. And here in the UK, even the patients know about the symptoms. Patients with type 1 are very much aware of DKA, because most of them would have come into hospital with something like this. So when they start having symptoms, they quickly come straight to the hospital. So the thing with the hyperglycemia is because there's a large amount of sugar in the blood, the body is not using, it just stays there. It causes all these weird symptoms, the frequent urination, which leads to dehydration. The patient's trying to rehydrate but not keeping up with the rehydration. So they're usually very, very, very dehydrated, these patients. Also, because the body's not using the sugar as well that it's producing, and sugar is building up. What the body does is to break down fat into toxic substances called ketones. Now, normally the kidneys will take care of the ketones and excrete them, and you be able to urinate them out. But because the rate in which these ketones are being produced is more than the body can take care of, they tend to build up in the system and cause a lot of damage. And you know, these patients are usually very, very, very sick and need hospital admission. So, and they can deteriorate very quickly as well. And some of the symptoms I would say that to note with hyperglycemic patients or patients with extremely high sugar are things like extreme taste, which I've explained about as well, due to the patient passing a lot of urine. They tend to become very thirsty, they have dry mouth, they are basically very dehydrated. And usually, in the management of these patients, that is the key thing, to rehydrate the patient as much as possible. Now, when you go for more severe symptoms in this situation, um, they can, like I said, they can deteriorate very quickly, go into coma as well. So, what do we do with these patients? When the patient starts feeling weak, when they start to vomit or they start having any sort of pain, those are severe symptoms. Those patients needs to come straight to hospital. For those with the early signs like urinating frequently, having a dry mouth, or increased thirst, you can encourage them to check their ketone levels, and there are kits that are available in pharmacies to check the ketones in the urine. And as I mentioned earlier, ketones are toxic substances that build up because of the breakdown of fats. And when this is happening, when the levels of ketones start to rise or it appears in the urine, that is a very dangerous sign, and then you need to bring them straight to the hospital. Now, some people may say encourage the patient to drink as much water as possible, but most of the time, it's not very, very effective, because when the patient gets to that hyperglycemic state, oral rehydration, or to that severe state, oral rehydration wouldn't do much to for them, and those guys have to come straight to the hospital. So unlike hypoglycemia, where if the patient starts having early warning signs, you can give them something sweet to take, or even if they're going to coma, if you have a glucagon injection, then you can give it to them. If you're sure that it's hypoglycemia causing the coma, then they should be able to recover. Hyperglycemia, on the other hand, is extremely difficult to manage on an outpatient basis. And even in hospital, it's quite difficult to manage as well. So those guys need very, very close monitoring, and because they can easily tip to the other side and require intensive care management. But usually, if we're able to identify these sort of emergencies, then we need to bring them to hospital. So before we get to this point of having or going into these diabetic emergencies, what do we do, or how do we prevent this from happening? So the most important thing, and I'll stress on this, is to monitor your blood sugar. It is extremely important. Majority of diabetic patients do not monitor their blood sugar. They've been told they were diabetic, say 2 years ago, 3 years ago, 5 years ago, and nothing is being done. They're not recording the blood sugar. Some of them are on daily medications. They could be taking daily insulin, or even oral tablets as well, but still not monitoring their blood sugar. Some of them just end up taking the medication without first noting what their blood sugar is, and it's extremely dangerous, because the reason why we ask patients to monitor their blood sugar very closely is that usually you're not on the same dose of insulin or the same dose of your oral diabetic medication for life. Usually the doses vary depending on how well or how poorly the sugar is being controlled. So if you're going through lifestyle measures, you're doing all necessary things that you have to do, your diet is on par, you're exercising, you're drinking lots of fluids, with that, your blood sugar, in addition to the medications, your blood sugar can be well controlled. And if you're still taking the oral hypoglycemic agents, the oral medications, that can reduce your blood sugar even drastically and put you into that hypoglycemic range. So that's the reason why you're checking it. You check it every day to see if it's getting controlled. And if it's getting controlled, and you keep going into hypo episodes, then you need to contact your doctor saying, I'm following the lifestyle changes, I'm using my medication, I'm going into hypo episodes. What do I do next? And then it's your doctor's duty to say, since your lifestyle has improved, the medication that you're using, we can decide to reduce it or we can decide to stop it to see if lifestyle measures can continue to sustain this, normal blood sugar for you. And if that happens, then, you may be off the medication for some time. And if you keep on with the lifestyle measures, you may not need to be on the medication. So, very, very important to monitor and document your daily blood sugar. It helps you, the patient, and also helps us, the doctor, to be able to make proper adjustments to your medications and a proper plan as to how we can better control the sugar level. And also with alcohol, normally we don't tell the patients to stop alcohol, but we tell them to reduce it. But the best measure is to completely avoid it. That's the best measure. When you tell people to stop alcohol, they give you a certain sort of look, especially here in the UK, because they like to drink a lot. But the best measure is actually to stop alcohol because that can cause complete derangement from of your sugar levels, and it also makes things difficult for us as well as the doctors because that means we will just keep varying your insulin doses or your oral medication doses, and that wouldn't lead to a proper control at all. And then, like I said, always make sure you have a journal to not just to note your sugar levels, but also as an emergency to have emergency contact of maybe your next of kin or your doctor as well, just in case anything happens, or if you're not with anyone and then for some reason you go into a state of unconsciousness or into, you black out, people are able to contact your emergency contact or your doctors, and then so that they can give them an idea of what to do and how to do it, and where to take you to, and that normally would be very, very helpful, in your management. So I would say all these measures are not just for people with living with diabetes, but for people who know people living with diabetes. It is extremely important because this gives you an idea of what to do for the patients pre-hospital before bringing them to hospital. And I would say even if after a hypoglycemic episode the patient recovers and the patient is fine, I would encourage you to always follow up with the doctor. Inform the doctor that you've had an hypoglycemic episode and this is what you think caused the hypoglycemic episode, and your doctor can advise you on what to do next, if there's any need for medication adjustment, or if you think you can continue those medications but just need to change a certain lifestyle to help with that. So this is basically about diabetic emergencies and what you can do pre-hospital to help you manage such emergencies. And again, if you're not sure of what to do, or you're not sure even if it's a diabetic emergency or not, then the best advice is to bring your loved one to the hospital or to come straight to the hospital, and then we can investigate further to see or try to figure out what exactly is the cause of the symptom. So thank you very much. I hope this presentation has been clear. I'm open for any question at all, and you know, or any contributions if anyone has. I can see that there is a question from someone called Oladapo Dapsin, um, that's asking if diabetes is truly a progressive disease. So if Dr. Marvelous doesn't mind, I'd like to answer that question if that's okay.
Yeah, sure. Usually we wait till the end to answer questions, but you can go ahead.
Okay, yeah. So yeah, just to address that question because it was asked a while ago. Yes, diabetes is a progressive disease if it's not controlled. So poorly controlled diabetes is progressive, and it is the result of, like I said, the excessive buildup of sugar in the bloodstream. Um, Normally, the insulin produced by the pancreas is supposed to help take that sugar into the cells so that the cells can use to produce energy. And if this is not happening, the body, number one, would break down fat to try to get a source of energy, because the body needs energy and it will get that from ketones, which is not an appropriate source of energy. And now what happens is the body keeps breaking down the fat, patients keep losing weight, patient keeps producing ketones, ketones keep building up, and the body is not able to take care of the ketones. Ketones become very toxic. The patient becomes what we describe as acidotic. That means the acid nature of ketones build up in the body, causing lots of derangements. And that can just progressively lead to more complications. And that's even the acute complications. And then progressive in the sense of more chronic complications, yes, it can cause problems in the brain, in the eyes, in the heart, in the kidneys as well, in the blood vessels as well. So yeah, so poorly controlled diabetes is progressive, and that is why we always stress the importance of very good blood sugar control, and also the importance of prevention, so we don't even have to talk about progression of the disease.
Okay, thank you so much, Dr. Wale, for answering that question. So I'm just going to stress what he said. It is progressive if you do nothing about it. So if you are, not taking care of yourself, if you're not doing all you need to do, if you're not taking care of your meals, your exercise, if you're not taking your drugs, unless it's constrained by your doctor, then diabetes will be progressive. It affects everything from your head to your toe if you do not take appropriate measures. And this is why you cannot just look at diabetes destroy your life. You have to get into the driver's seat. And that's what all these webinars have been about. Okay, if you see the theme has been your health in your hands, you must get into the driver's seat. When it comes to diabetes, you must be proactive about it. All right. So, in fact, he said a lot of things about diabetic emergencies and how you must know what to do, how to identify them. And I need to say something. Glucagon injection is not readily available in Nigeria. Okay. So, I know that some of us might
Unfortunately.
tomorrow, yeah, go to the pharmacy and say, I want to buy glucagon injection. Dr. Wale is in the UK, so of course that is available to everybody there, but here is not available. So you need to have glucose at home for if you're prone to hypoglycemic. In fact, in the book that I wrote, The Ultimate Diabetes Guide, I listed the things that everybody living with diabetes must own. All right, so if you don't have that book, you need to get that book. We have the e-copy, we have the hard copy. I listed everything that you must own in your house at every given time. And those things are to prevent these emergencies, because if you do not have certain things, all right, to care for your diabetes, then you can run into trouble. You can actually have emergencies and you will not be able to handle them. So we talked about glucose now. We have glucose powder in Nigeria. We have glucose the tablets. You can get those, you can have those along with every other thing that you should have as a diabetic. You must have your glucose monitor, you must have your journal. I listed all of them in that book. And then I also wrote step by step on everything he has said, how to handle both the hyperglycemic and the hypoglycemic emergencies in your house, all right, before you get to the hospital. They are all outlined there. So you just have to get the book so that you have this manual at home, that even when you don't have to remember everything, the book is there for you. You can easily just take a look at it and remember. So take very, very good care of yourselves, because diabetes is indeed progressive if you do nothing about it. So please let us appreciate Dr. Wale. Thank you so much, Doctor. In the comment section, let's say thank you so much, Dr. Wale. Thank you for taking the
Thank you very
time
much for having
to
me. Thank you.
share. You're welcome, sir. So thank you for coming on this the webinar, and for sending us, or for teaching us everything we need to know about diabetic emergency. Somebody's asking how to get the books. So, sir, are you on YouTube? Okay. If you do not mind, somebody is going to drop a message on YouTube now to show to a WhatsApp number that you should just reach out to. And I'm also going to share that the account number and the WhatsApp number, especially for you to just reach out to. So you can just go to that WhatsApp number and just say, I want to buy the book, and you'll get the book. So just find a way to get to us, and I'm going to display, or maybe I should just do that right now. So please, we have someone else that will be talking to us about this emergency, what to do if you're in Nigeria, in a second. But because of that question, I'm just going to quickly put the number on the screen so that we can quickly, in case anybody wants to get the book. Okay, now this is the number. Just reach out to this number and oh, what happened? Just reach out to this number and and just indicate that you want to get the book. So just ignore the top part, just get the number. Right, the book is 5,000 naira for a hard copy, and 3,500 for the soft copy. So you just let us know which one you want. 3,500 for the soft copy and 5,000 for the hard copy. So this is the number. In case anybody wants to get the book, just reach out to this number on WhatsApp or call or anyway text message, and we'll get back to you. So let us tell Dr. Wale thank you, and let us bring our, so you can do a screenshot
Thank you
of
very
this
much,
number so
guys.
that we
Thank you
can
for
bring
having
on.
me, Dr. Marvin.
You're welcome, sir. Thank you so much. So we are going to bring on someone that's very, very, important in the space of emergencies. He heads a company in Nigeria that deals strictly with emergencies. So unlike, we are in Nigeria. Dr. Wale is an emergency doctor in the UK. They have everything that they need. They have ambulances. They have all of that. And but many people in Nigeria are not, they don't have that readily available. That is why we need to know what to do in our houses before we even get to the hospital. However, there is somebody here that his company has been able to sort out that emergency situation for us. Okay, they are available. If you have them on speed dial, if you have a problem and you need to get to the hospital, they will come pick you up and take you to a hospital, and they are affiliated with a lot of hospitals. So I'm going to bring up Mr. Patrick Aswama right now, and he's a country head of Emergency Response Africa, and that's what they do, emergency response. Okay, they are bridging the gap that our healthcare system has left, to just get worse and worse. We found out that in Nigeria there's a problem with being able to access or to assess emergency services. But Emergency Response Africa, they are here and they are making that happen every single day, helping people to access ambulances, helping you to provide. In fact, well, we're going to talk about it in a minute. So I'm just going to bring him up right now. And Mr. Patrick, I'm going to share your slides. We can say hello to everyone. Um,
Hi, good evening, everybody. I'm very happy to be here, and I can see a lot of persons joining from different parts of Nigeria and also across the world. Ikeja, Atlanta, Kaduna, Aja, you know. Thank you very much. Okay, so not to take most of your time, my name is Patrick Aswama, the country head of business for Emergency Response Africa. Like the name, connotes, and it's actually intentional because Emergency Response Africa. A lot of people will ask why Emergency Response Africa. Really intentional about that name because of to healthcare delivery, especially when it comes to emergency response. Most time we'll just say that we are the 911 when into every form of emergency, in Africa as a whole. So what do? We are a healthcare technology company that is actually changing how medical emergencies are being managed. And our mission is to help believe that when is achievable in Nigeria, definitely replicating it across Africa as a whole, it's going to be very, very easy. And how have we, achieved this? We've achieved it by building the largest network of first responders and also emergency vehicles and verified hospitals across Nigeria. And at the same time, we connect emergency victims to help using our smart technology that we've created in-house. Then at the same time, we provide end-to-end service care at the scene, and if needed, transport to the hospital. What this means is that we've been able to create the largest network, built the largest network of first responders. First responders are spread across different communities, in Nigeria, Lagos, Abuja, Port Harcourt, Oyo, Delta states, and some other neighboring states as well that we've been able to do this. And also, we've built the largest network of ambulance service. That means If you need if someone is actually experiencing any form of emergency, or you need an ambulance to transport somebody from one hospital to another, or from one particular location to another, we've been able to coordinate a large network of ambulances across, all the coverage area that we operate. That if you're having an emergency in maybe in Lagos or somewhere in Ikeja, we don't need to dispatch an ambulance from Ikorodu. We dispatch an ambulance from Ikeja that is closer to where the incident is actually happening. That's how smart our technology is. Then now the big question is, most of the time, a first responder gets to a scene of an incident, he conduct a triage, do treatment and the rest, and maybe move the patient with an ambulance to a verifiable hospital. Most of the so what we do is we've created what we call emergency. There are hospitals that we've classified as emergency ready, and these hospitals, not just every hospital are emergency ready. The hospitals under our network are classified as emergency ready because why? There are certain criteria and certain trainings that we've done for this hospitals network in such a way that whenever there is any form of emergency that is coming from under our network, they can easily commence treatment in less than 5 minutes. So the overall goal is to ensure that we save life, because every year over 1.2 million Nigerians die due to different illness and different scenarios. But out of this large chunk of death, majorly the over 20% or over 30% are caused by lack of emergency response. And for our target reach, the people we really focus on are people that first managing maybe chronic illnesses, like diabetes, treating one illness or the other. Then the age people, maybe people living outside the country, and they have aged parents or a family that they are looking after. So these are more like our target market, because emergencies are things nobody plans for. But when it happens, when it does happen, but you don't plan for it. But what we as Emergency Response Africa is doing is to ensure that people get fast response at every point in time, and we want to ensure that every Nigerian and every African gets help in less than 10 minutes. That's our vision, to ensure that whenever there's a form of emergency, people get help in less than 10 minutes. And how does this work? Now, with our smart technology, we have a toll-free line in which people can always call us at every point in time. That line is open 24/7. You don't need to pay whenever you put a call through that line. It's just one request. You make the call. A paramedics or a doctor from the end, can easily be giving you a phone face aid on what to do if there's any form of emergency. Before a first responder or a paramedic gets to the scene, to conduct a triage. So this is the number you call. This is the number that you can call at every point in time whenever we have any form of emergency. That number is open 24/7. And the most interesting thing is, whenever you call, whether you are a subscriber or not to this service, you definitely get help. You definitely get help in terms of phone first aid on what you need to do, and how you need to react. Most of the time we understand that someone that is actually experiencing any form of emergency might not be able to carry out some certain things, some certain first aid skills that the paramedics or the doctor will be giving on the phone. So we always advise that people place this number in strategic locations in their houses, that even if anybody can call whenever there's a form of emergency. So we have this toll-free number, and also we have an app that people can actually request help with. The app is on iOS and also on available on Google Play Store. So you can just go to your app store, you download Signal by Era. With this, you know that you are covered in any form of emergency. And since we started as a company, we've attended to over 1,300 incident cases. And out of those cases that we've attended to, about 16.9% are diabetic patient cases. People that are managing, one form of one illness or the other, they are managing diabetes, and because these are things that happens, but people don't plan for it. So we always advise people that they should be emergency ready, because when you are emergency ready, there's this peace of mind, apart from the cost that will come with it at the point of emergency. There's this peace of mind that, oh, you have this covered. So at emergency ready hospital, our goal is to ensure that every Nigerian, every African get fast, affordable, and reliable emergency help in less than 10 minutes. And we've been able to achieve this by the network that we've built across the ecosystem, from the paramedics to the first responder to the ambulance network, and also to the largest emergency verifiable hospitals across Nigeria as a whole. We are currently in Lagos, Abuja, Port Harcourt, Delta, Oyo, and Ogun State. Then also before the end of the year, we intend to add additional 6 more states, and by next year we intend to cover um, the entire Nigeria space as a whole. So this is more like the coverage states that we have, and this has been we've been able to do this with the help of people that understand that there is a gap that needs to be filled when it comes to emergency response in Africa. We've been able to work with a lot of corporate organizations. We are currently in partnership with some state governments in managing and coordinating their emergency units, especially like Ekiti State government, in which we're currently coordinating and managing the ambulance network as a whole. Then also we are there are some other states that are forthcoming that people that this state government have approached us that okay, they want to understudy what we are doing. What we are doing is something that they want to really get into. So talking about someone that is managing diabetes, these are things that you need to know. These are the help that you can always get at every point in time. Those that phone number is the toll line is free. Whenever there's any form of emergency, you can always reach out to us there. And also the Signal by Era app is actually free. And at the same time, we also do training in which people can be trained, to on CPR and first aid, so that whenever there's any form of emergency, you can just do the basic things to sustain and stabilize that person's life till a primary help comes into place. And these are some of the services that we provide, unlimited access to 24/7 call center with trained emergency personnel. That means phone first aid. If you call us now, definitely there will be a paramedic on site that will definitely respond to your call. Then also what we do is on-site treatment and ambulance evacuation to verify the emergency ready hospital. What this means is that whenever there's an incident or an emergency in a particular place, we dispatch a first responder to that place. Looking at the terrain of Lagos, what we've been able to create is we have doctors on bike. That means whenever there's an incident due to the traffic situation in Lagos, we dispatch those paramedics on bikes that will get to the scene in less than no time and ensure that okay, they conduct a triage. Then if there's a need for them to evacuate that particular patient to a primary care center, that's where the ambulance network comes in. And all these are coordinated seamlessly via our smart technology that we've created for easy communication. That means from the point of the incident to the ambulance to the hospital, we don't need to go to the hospital and start telling them, oh, we have this patient here. At the scene of treatment, there is a communication that is already been passed already to the hospital that so case is coming. They will give details and information that is accurate, so that once the patient gets to the hospital, treatment commences in less than 5 minutes. Because why? This we want to ensure that we close that gap of delay that leads to death and rest. Then also we have access to virtual and in-person first aid and BLS training and certification. Then also we have first aid kits and also activating emergency response sign for delivery vehicles. Then we manage practical simulations. Then at the same time, like the app is everything that has to do with emergency. So whether you're having a medical emergency, you're having a security emergency, any form of emergency, if you go to the app is interlinked with different states, with the police, is interlinked with the DSS, is interlinked with the Federal Road Safety Commission, is interlinked with even somebody suffering from domestic violence, somebody that has a rape case. So the app is interlinked with every cadre of different agencies that manage different form of emergency, from rape to child abuse to domestic violence, to legal. So it's interlinked. So all you just need to do is request help, and in no time you get help. If you're having a security situation, you can either directly get in contact with the commissioner of police in Lagos State, or depending on the state that you are that you are residing, or the chief of police. And in less than a few minutes they will dispatch help to you. So this is what we as ERA are doing in trying to ensure that we close that gap when it comes to the delivery of fast and affordable healthcare in Nigeria. I believe I've taken much of my time. Thank you very much. I don't know if there are questions, with respect to this.
Thank you so much, Mr. Patrick. Like this was so informative, and I'm very happy that your company has stepped in, because this is a huge gap that Nigeria has. Emergency services has not been something that people can actually access, and giving us a toll-free number to call, knowing that experienced people, that actual real first responders who are trained are going to respond to give both phone help and even come to the scene to help. And also the fact that it's linked to different kinds of emergencies is really, really commendable. Thank you so much, sir, for coming on this webinar to enlighten us. And I hope everybody got the toll-free number. Please save that number so that you never know when you're going to need it, and share it with your loved ones. If you have diabetes or any other chronic illnesses that might lead to emergencies, please share with people around you so that whenever you need help, somebody can call. All right, so it's also important that everything you've learned here about diabetic emergencies, please share with people around you, because if you have diabetes and you are in an emergency, you might not be able to help yourself. All right, so people around you are the ones who would likely step in and help you. And Mr. Patrick, please let us say thank you to Mr. Patrick, in the comment section, and thank him. And I hope that we are downloading that ERA, the Signal app right now. I hope we are downloading it and we are saving the number. Everybody should have that number, whether you have diabetes or not. You
iOS and
never
also
know.
on the Google Play Store.
Yes. So please, you can just get it right now. Let's appreciate him. Thank you so much, sir. And thank you to your company for this amazing opportunity. And there's a discount for anyone that comes through us that needs the services. There's a 10% discount. So just let us know, if you need the services, further services from them. Thank you so much, sir, for coming. Please let's appreciate Mr. Patrick in the comment section, and we'll be done in a few minutes. So Mr. Michael
Thank you very
Obaseni
much.
says, okay, so I'm going to show this now. Um, Mr. Mr. Augustine says, thank you, Mr. Patrick. I'm amazed at the company in Nigeria. Please carry out more enlightenment programs to sensitize more Nigerians. Yes, please. So we're going to have to do more of this. To let me even share how people can reach your company. All right, so I'm just quickly going to share. So this Mr. Michael said, I'm from Lagos State. He's going for this opportunity. So this is amazing, right, Mr. Patrick? We need this, and I'm going to put their contact details on the screen right now so that you can see how to read the company. This is the app. This is their number. Please take a screenshot, and then this is how to reach them in case. Oh, I hope we can see this. This is their website. These are LinkedIn. These are Facebook. These are just all the ways to reach them. Okay, so this is everything about them, Instagram and so on. So you can always type their name on Instagram to find them, and this is how to reach them. So thank you so much, sir, for coming on this webinar. We truly appreciate you and your company for all that you've been doing. Thank you so much. Yes, so we appreciate you and we are happy. So as I was saying earlier, as we round up, okay, um, there is so much for us to do with diabetes. Diabetes is something that you must be prepared. All right, you must prepare for emergencies. You must be on top of your game every single day. You must truly take your life, your health in your hands. If you have diabetes, or if you live with someone who has diabetes, if you are a caregiver, or your loved one has diabetes, you must know these things. And that's why we're having these free webinars to show you everything you need to know, from managing your food. We did earlier the first webinar. You can watch the replay later, and right down to now emergencies. So I'm just going to share this right now, and I'm going to show you. This is the book I talked about. So please get this book. It's very important that you get this book so that everything you need to know, even about taking care of your food, so that you don't have diabetic foot ulcers, which can lead to amputation, diabetic emergencies. They are all listed step by step in the book, as well as how you can eat, how you can exercise, sleep, and several other things that you need every single day to take care of diabetes, to avoid emergencies and complications. Available in ebook and hardcover copies. All right, ebook is 3,500 and hard copy is 5,000. So I'm going to show you our number again so that you can place your order. And this book will show you 15 mistakes you are making that are raising your blood sugar and tilting you towards emergencies and complications, and how to identify diabetic emergencies and what to do. So everything we've talked about today, they're all itemized in the book. Then food hacks to help you overcome or to help you control your blood sugar, and even pre-diabetes for those who are at risk of diabetes, who are not yet diabetic but have a problem with their blood sugar. This is how to reverse pre-diabetes and even how to prevent it if it runs in your family. All right, so you can avoid diabetic emergencies. You can live a happy, fulfilled life without worrying about your blood sugar. This is real. Trust me, it happens. All right, and this is a man that I worked with. He sent me a text, and I just had to put it up here. He was overweight. His blood sugar was so high, and when he came on and we worked together, he started recording 83, 85, 87, which are very good blood sugar levels. They're less than 100, and that is so fantastic. So I'm trying to tell you that it is important and it is necessary that you do what needs to be done to control your blood sugar. So if you want to be like Mr. Frank, right, you can work with me the way he did. You can book a 90-minute session with me, and we can sit together for 90 minutes, no matter where you are in the world, and we can have a full 1 hour, 30-minute session, and we can create your personalized lifestyle plan. It's personalized because it's what you can do, the food you can eat, the food you like to eat, the kind of exercise you can do, not what everybody else is doing, how much sleep you get is extremely personalized. All right, and that is what Mr. Frank that sent his testimony did with me, and was able to get all those results. All right, so this lifestyle plan will cover a healthy diet specific for you, simple exercise routines depending on what you like, stress management, improved sleep, and everything is made for you. All right, so no matter your preference, your work schedule, your location, your age bracket, your health background, we will together, you and I, create the right lifestyle plan tailored to cater to your needs. And you are in charge. All right. So you can say, oh, doctor, I do not like to eat this particular kind of food. I do not sleep this much, or I have this kind of job. I work nights. Things like that, okay, are going to be factored in. So it's personalized, and it is easy, personalized, and sustainable. This is very important so that you can always do these things no matter where you find yourself. So this 90 minutes is 15,000 naira, all right, for 90 minutes. And you and I will go through everything you need to know to control your blood sugar. This is also the same number that you would reach out to if you want to book your 15 minutes, your 90-minute lifestyle consultation with me, or if you want to buy the book, or if you want to do both. All right. Please save this number. This is our number. You can have it on your phone because we teach a lot on this number. We usually educate people a lot weekly, like 3 or 4 times every week, to educate people about diabetes and other conditions. So you want to really have this number, in your phone, stored in your phone. All right. So we have come to the end of this session. And if you have questions, please ask them now. Or if you do not have questions, that's covering diabetic emergencies, covering ERA, whatever you need, you can type it in the comment section in a minute, and I will attend to it immediately. And this is the number, so you can just quickly take a screenshot of it and save it, and give it to someone who needs it. But you can book a lifestyle session with me or get the book using this number. And also we teach on, we send broadcast messages to our people, teaching them almost every 2 days or so on WhatsApp. All right, so we do not have any questions. Um, I'm going to say, hold on. So I'm going to say thank you so much for coming. And it's my belief that everybody has been better, for coming. It's my belief that you are happier right now than you were when you joined. It's my belief that you are more in control of diabetes right now than before you joined, and that you're going to take everything we have said here very seriously. Now we have emergency services, but we also have ways to prevent emergencies from actually happening and a way to control them if they actually happen. So we have covered all the bases tonight, like all your bases are covered tonight. So you can go take your rest tonight, sleep very well, because you are now more in control of diabetes than you were before this webinar. Thank you so much for joining. God bless you all. And if you ever need us for any reason, you have our number, reach out to us and let us know. You also have the ERA number, and so that you can reach them and share to people who need their services, okay? Because they have been very, very, very wonderful to people in our communities. Once again, thank you for joining this webinar. Have a lovely night.